Live, this is KDLT News Today on NBC.
All right, thanks a lot, Kelly. Well, 27 million people have osteoarthritis, and that number is expected to increase to 40 million by 2030. Osteoarthritis is a disease that takes its toll on our joints and causes the need for many knee and joint replacements each year. And joining us this morning to tell us how we can better take care of our joints and tell us more about some other options to relieve knee pain without surgery is Dr. Stephen Meister and Vicki Kolstad. Welcome, you guys. Thank you for joining us this morning. Doctor, I'll just kind of start with you. Why are people having so many knee problems nowadays? It seems like it's becoming more and more the forefront of.
There's a multitude of factors. Number one, we're getting older. The population is getting older. Number two, and I hate to pull punches, but people are gaining more weight. More stress on the knees and the bigger joints of the body. They tend to wear out quicker. Now,
a lot of people, of course, when their knees hurt, a lot of them undergo surgery and stuff. But there are some other options out there. Kind of tell us about those.
There's quite a few options. I'm a family physician, and our job is as family doctors, is to do preventative care, Phil. And what we like to do is to stave off surgery as long as you can. Surgery is not to be undertaken lightly. It's got lots of possible comorbidities and other problems that can occur, such as infection. And so if you can stave off that surgery as long as possible, we like to do that. Some of the options include steroid injections into the knee joint. There's a material called Synvisc that is made out of the coxcomb of a rooster. It's hyaluronic acid. It is kind of like a gel that goes in and replaces and creates a cushion. That can be injected in, and a lot of patients get good relief from that. And then there's this device here called the Bionicare.
Tell us a little bit about this. Now, this is something that you can do without having surgery too, and this, I've never heard of this before.
Yeah, this was invented, it was invented a long time ago. It was initially put out in 2003, and it got Medicare approval in 2009 and became widely available at that time. And what it is there's two components of it. You have the neoprene brace that goes over the knee, and it's got a couple of gel pads here. It's got little electrical, these pads carry an electrical conduit and generate a little microvolt electrical signal that goes through the knee. The brace, if the doctor prescribes the brace, offloads the knee so that the upper part of the leg is offloaded a little bit from the lower part so that the weight is taken off a little bit and this brace just supports. It's worn mainly at night. The peak efficacy, it doesn't come right away. This isn't an overnight fix, and it should not be perceived as one. It takes about 1,700 hours of continuous use, most people wearing at night to get the use, 12 hours at night. You wear it, so that equals out to be about 4.5 months. You wear it, and the studies have shown that patients get extremely good relief from it.
Cool. All right, Vicki, you wear this, and tell us a little bit. Has this helped you?
It has helped me a great deal. I've already had knee surgery, complete knee replacement in my right knee, and I was on my way to needing it on my left, and I did not want to go through that again. And so a friend of mine had told me about this, so I checked into it, and I'm wearing it right now. I have the little
simulator.
Simulator, and I can keep track of my hours and everything. When I started wearing it, it was about between 300 and 400 hours, and I already had relief. I could take the stairs, which I had a lot of trouble with.
Very neat.
Before.
I'm sure this will help a lot of people. And Doctor, real quick, we only have a few seconds left, but tell us a few tips if people are having pain, what they can do about it.
If you're having severe knee pain, the first thing you should do is go to see your doctor. Over-the-counter medicines are helpful, but you really should see your family doctor, your primary care doctor, to get the gestalt. An x-ray is necessary to find out how much disease you have. There are certain people who, regardless of what we do, are going to need surgery. The knee is a joint, it wears out, and eventually you need surgery. Our goal is to prevent that surgery or push it back as far as possible and preserve what the body naturally has as long as possible.
All right, thank you, Doctor. Thank you, Vicki, for coming in this morning. For more information on this, all you have to do is just log on to KDLT.com. And now here's